team to ace all the dentists' global career abroad, specifically in Australia, as we're going to talk about it. Okay, so we have a small discussion first regarding your ADC masterclass with your expert faculty, and after that, we'll be taking up your question. All right. Okay. So let slide change, please. Yes, thank you. So let's talk about academically. So we are basically headquartered in Australia, as you all know, and Dr. Akram is a well-known personality over there in the field of healthcare professional. And I'm sure you all would have seen us in a lot of social media and digital places. So guys, academically, so basically we are an edtech, and we are helping the healthcare professionals who want to upscale their career, who want to migrate abroad, and who want to flourish as a dentist, not in their own country, but abroad. And academically was basically established by Dr. Akram, and sir has years of experience across several roles in various countries like India, Malaysia, and Australia. So the basic question was, the most important and the most weaker section and the most weaker mentality of healthcare professional was they didn't know what opportunities we have, because we are not, there's no placement for us, there is no short career option for us. So this was the mission of academically, to establish a proper career option and to guide you all for the various opportunities which you get as a dentist, as a nurse, as a physiotherapist. So we not only cater to dentists but all the healthcare professionals, and we offer guidance, we offer resources, and we offer an unwavering support to all the healthcare professionals. Talking about our founder and CEO, so Dr. Akram Ahmed, as you all know, sir is an esteemed clinical pharmacist. He has been a distinguished professor, and he has more than 15 years of experience in various countries, I was telling you. And you all would have seen his story before the webinar. Brands of Tomorrow episode was being telecasted for you. So whatever struggles he has faced, whatever hardships he has faced, the only motto and the only mission of Team Academically and of Dr. Akram is to create a proper pathway for all the healthcare professionals. That's the only goal. And we help you. We are a EdTech. We provide education and training for not only pharmacists, dentists, doctors, nurses, lab technicians, physiotherapists. So we're trying to touch every healthcare profession so that we can pay an unwavering support to all of them. And not only licensing, foreign licensing exam, we also have a study abroad platform of ours to further support the career advancement of healthcare professionals. We have launched EduCafic, which is a study abroad program. I'll tell you more about that. How do you join the channel for it, right? Now, talking about the academic heads. So if you talk about the academic heads, we have Dr. Rini Sharma. She is serving as the assistant academic head for all the medical courses. She's got an experience in the exams. She's herself done her MBBS MD and an MBA from Charleston University. So all the content, all the academic creation is done under her guidance. We have one more academic head, Dr. Alok. He heads the pharmacy courses, and this is the way our team academically works. So now I'll introduce you to one of our faculties. Here we have Dr. Tanya. These are our faculty list. Hi, Dr. Tanya. Do we have you on board? So Dr. Tanya is basically, as already mentioned, she is an ADC1, ADC2 qualified person. And Dr. Krupal Lakshmi is there, Dr. Chandni is there, Dr. Hina is there, Dr. Kelly. So all of these faculties have undergone the similar journey as you all are going through. Yeah, so this is something which is very, very important if you talk about the journeys, right? People don't know how to go by, people don't know how to prepare for these exams. So that is very, very important. Yes, Dr. Tanya, you can stop the screen share, and let me introduce you to the students, and then you may continue your session. All right, so she has been working very hard with our students. She has been an unwavering support to all of us. So hi, Dr. Tanya, how are you?
Hi, Dr. Sonal. I'm good. How are you?
All good, and we can very well see you, and we can very well hear you. So over to you, Dr. Tanya. You may start with the session. And guys, here's Dr. Tanya in front of you all. She is an ADC1, ADC2 qualified person, registered dentist in Australia. She will guide you. So quick thumbs up to her. And ma'am, we'll be starting with the session. The students are yours, the dentists are yours, and you may go ahead with the session. I'll take a break from you all, guys. And ma'am, once you are done, we'll take the questionnaire. Thank you so much, guys, for such a good support. Ma'am, over to you.
Thank you so much, Dr. Sonal. And thank you so much for the introduction as well. So like Dr. Sonal said, I have cleared my ADC part 1 and part 2. I had actually entered this journey 2 years back. Okay. And just like you, I was struggling with the process. But then With God's grace, I was able to clear both my part 1 and my part 2 in my first attempt. And I'm also a registered dentist in Australia. So today, we are going to take a very important class, both in terms of ADC and clinically also as well. Okay, it is regarding impacted third molars. Just going to, share the screen. Let me know if you can see the screen in full screen, okay?
Ma'am, your screen is visible. We can see your screen. You can go on present. Yeah, you can
You
go
can
ahead.
see it, right?
Yeah, please go ahead.
Okay, right. All right, okay. So basically, we are going to discuss a case about an impacted third molar today. Okay. So usually ADC gives you a very elaborate scenario, and then you are usually given a few SBQs, like a scenario-based question with certain answers. You will be given option A to, 3, 4 options would be there, and you would be needing to take the most appropriate answer. Okay. So here today we will discuss a scenario and we will look at what kind of questions can come with ADC. Okay. So let's look at the scenario, guys. A 24-year-old patient is referred to you in your oral surgery-oriented practice for a second opinion on the need for removal of his lower third molar. Is this the correct decision? And if it is, how should it be achieved? Okay. So a 24-year-old patient has been referred to you for a second opinion for his lower third molars. Let's see what could be his concern. Okay. So this patient, right now he does not have any complaint at present. But he has been advised by his general dental practitioner, his dentist, to have his lower third molars extracted. This patient is very nervous about the extraction and he requests a second opinion before deciding on treatment. So this patient is very, very nervous. Now, this nervous word is very important because in Australia, you have to be very, very, very careful with patients. You have to, deal with them with utmost care and, they should feel very, very comfortable. In case a patient does come to you who's very nervous or anxious, you must try some, either, some pharmacological techniques or some non-pharmacological techniques to manage his nervousness or his anxiety. Because at the end of the day, he must leave your clinic with a good, he must leave your clinic with good experience. It must not be traumatic. So you do have some pharmacological techniques and non-pharmacological techniques. It is actually a different topic. Non-pharmacological techniques would involve, you can show him around the practice. You can speak to him about the procedure, make him less nervous. Okay. He can even, if there's a television in your practice, he can even watch his favorite shows, be more relaxed. So if that doesn't work, you can even opt for some pharmacological techniques as well, where you can give him some medication. Oral benzodiazepines can be given to make him more calm. You can even try, laughing gas. If nothing seems to work, you can even, refer him to a hospital where he can get the treatment done under general anesthesia. So this nervousness is very important. They can ask you questions based on this. But anyways, this particular patient is quite nervous. So he wants to have a second opinion before he wants to decide on the treatment. Let us look at what is the history of presenting complaint. Now, why was this patient referred to you? So the patient has had 2 episodes of pericoronitis around the lower left third molar. So we're speaking about the lower left third molar. He's had 2 episodes of pericoronitis before. So we know what pericoronitis is. So usually in the third molar, there can be a flap covering it, which can, get irritated and inflamed, leading to a condition called as pericoronitis. So this particular patient, he had 2 episodes previously around the lower left third molar. The first episode was kind of mild, was okay. But the second episode, which occurred around 3 months ago, was associated with inability to open the mouth, a little bit of trismus. He had a little bit of facial swelling as well, necessitating a course of oral antibiotics. So it has spread from a mild one to kind of like a spreading odontogenic infection. Okay. So that's the reason why his dentist has referred it to you. So now we've understood why, what is the cause, what is the reason for the tooth being removed. It's also important we understand about the medical history because again, ADC is very particular about understanding the patient's medical history. Questions can be coming regarding that, if he's on particular medications, you might need to, modify your treatment accordingly. If he's got certain procedures done, again, there can be modification in your treatment planning. So this patient, luckily, he's fit in well. He doesn't have any medical conditions. He's had a general anesthesia previously to reduce and fix a compound fracture of his arm, which was permanently plated He's had no problems with bleeding after trauma. So this patient did not have any issues. And he's even been given, he had a fracture, which was, treated before under GA, but no other issues. Sometimes, it can be, the questions can be complicated with some medical histories. Like sometimes, for example, if the patient is asthmatic, you may need, you should avoid, if they ask you, for example, what could be the most appropriate medications you should give. If any, NSAIDs is given, you should avoid it because it should not be given to patient who's asthmatic. You can't give ibuprofen or something. Or for example, if the patient is on warfarin, for that matter, you may need to do certain tests like an INR before the extraction procedure is done. So you have to look at the medical history. Very, very important. So this patient, he is fit and well. The next thing that we do is basically we have to do a proper examination, both starting from the outsides of his face and then the inside of his face. So the extraoral examination would involve checking for any extraoral facial swellings, checking for any lumps or bumps on the neck, like any lymph node enlargement. So this particular patient, he had his left submandibular lymph node. It was palpable and it was not tender. And there was no facial asymmetry. Again, the next thing that you do is you have to do a detailed intraoral examination. Okay, the intraoral examination involves complete assessment. You have to look at his interincisal opening. So what is interincisal opening? It is the distance between your upper incisors and your lower incisors. This will give you an indication whether the patient has got any difficulty with opening his mouth. Because if he does have difficulty opening his mouth, then it will complicate your procedure. It will be very difficult to go about with the procedure. So one reason determining the axis for surgical removal and accepting the difficulty of extraction, trismus may also reflect infection or inflammation in the muscle. So if the muscles of mastication also has got some inflammation or infection, that can also show up as trismus. What is trismus? Difficulty opening the mouth. You also have to check for the condition of the rest of the dentition. Why? Because sometimes if the first and the second molar, so we're talking about an impacted third molar here, right? Now, if the first or the second molar has got a poor prognosis, like it's got a huge cavity, or even, very extensively restored tooth, you can even consider removing that particular tooth and transplanting this third molar into its place. That could be considered. You also have to have a good look at his oral hygiene because that can also reflect some of the post-operative complication that can happen. For example, if this patient had, imagine if this patient had a very poor oral hygiene, that would put him at an increased risk of a condition called as dry socket, sometimes soft tissue infection, even delayed healing. We know what dry socket is. So what happens is once we pull out the tooth, there is an area of, there is an empty area that is created, which ideally should be filled with blood and forms a clot. If the clot is dislodged for any reason, it exposes that area. Food can accumulate, and it's a very, very painful condition. So oral hygiene is very important. You have to check. This will all give you an idea whether this patient could be prone to a dry socket or a soft tissue infection or even a delayed healing after the removal of the third molar. Now, the position of the lower third molars as well. So the degree of the eruption, the angulation, and the proximity to the second molars are important. So again, the position of the third molars also will give you an understanding as to how difficult the tooth removal can be, how easy the tooth removal can be. For example, okay, for a lower tooth, based on the angulation, a disto-angular impaction is very difficult. It's the most difficult considered. And for an upper, a mesioangular oriented third molar impaction is considered very difficult. So position of the lower third molars also is important. You have to identify all of this. Position of the upper molars. Now, sometimes what happens is that the upper third molars can start to supra-erupt. Sometimes it can be buccally erupted, again traumatizing the tissues in that area. So you may consider removing the upper molars as well. Position of the external oblique ridge. If this lies close behind or over the impacted tooth, access is very poor. And considerable bone removal may be required if the tooth is large or impacted. Okay, so if there is an external oblique ridge covering the tooth, you have to remove more amount of bone. Condition of the lower second molars. So if the lower second molar, for example, imagine the third molar, you're removing a third molar, and the adjacent lower second molar has got, has got a huge filling, maybe distal filling, or even if it's got a huge, it's got a crown restoration. You have to be very careful because there is a chance you might iatrogenically damage that tooth. Okay, so you have to also look at the condition of the lower second molars as well. Presence of pericoronitis, very similar to oral hygiene. In case he has pericoronitis, it's got similar effects as generalized oral hygiene, meaning to say he could be more prone to catching infections, dry socket and things like that. More chances of adverse effects after the tooth has been removed. There can also be some miscellaneous features as well, like sometimes it could be that the treatment can be complicated because of the patient factors, like gag reflex. Okay, a poor patient compliance. He is not cooperating at all. Compliance is very poor. Anxiety. Okay, these things can make your treatment a little bit difficult, or it can make your treatment. It can affect your treatment basically. Now let's look at this case. What is going on with this particular scenario? So in this case, the patient has got a normal mouth opening. Good, he's got a normal mouth opening. He's got a full unrestored dentition, and he's got no signs of caries, periodontal disease, or poor oral hygiene. He's got a good, his mouth is in good condition, except for that lower third molars, which is, constantly irritating him. So the lower third molars are partially erupted with a mild gingival inflammation, while the upper third molars are over-erupted and non-functional. Additionally, the patient exhibits a pronounced gag reflex during the dental examination. Now, the next thing, so you're done with your examination. You have finished your extraoral examination. You're done with your intraoral examination as well. You've got some idea as to what is going on. The next thing is you need to investigate further. So investigations, the most important investigation that we have to do here is basically we need to take an X-ray. Okay. And for third molar impaction, or in third molars for that, say, the CBCT, which is basically a 3D scan, would be the best. It will provide a very, very good view and, as to how close, like, the tooth could be close to a lot of vital structures. Like could be, if it's a lower one, it could be close to the inferior alveolar nerve. If it's an upper tooth, it could be close to your S sinus above, okay, the maxillary S sinus. So the CBCT would be the best, okay? But you can take additional radiographs. You can take periapicals, OPGs. OPGs would be better than periapicals because it will give you a broader picture, but CBCT would be the best. Okay, so radiographs are essential to evaluate the root morphology, the bone impaction, the nerve proximity, and even associated pathologies like cyst or hypercementosis. So a lot of views you can take: periapicals, OPGs, panoramic radiographs, CBCT, which provides the superior visualization, but involves a higher radiation dose, okay? Now let's look at the findings of this particular patient. The panoramic radiograph showed vertically oriented lower third molars impacted in soft tissue without caries or restoration. The roots appear close to the inferior dental nerve, but did not contact it directly. CBCT offers precise localization of the inferior dental nerve and a detailed tooth morphology, aiding surgical planning. This is basically an advantage and disadvantage of all the different types of views you can take. You can take periapicals, upper, lower, oblique, laterals, panoramic, lower, oblique, occlusal, CBCT. So this is the OPG of this patient which was taken. So in the exam, you can get scenarios like this. They will provide you with X-rays so that you can diagnose, you can, give your treatment. So here this is the OPG of the patient. You can see that this is the tooth, okay? This is the lower third molar that needs to be removed. This is the CBCT picture. You can see it is very close to the nerve as well. So normally, what could be the indications of removal of the impacted third molar, or of a third molar? Recurrent pericoronitis. Patients got recurrent episodes of pericoronitis, like for example, this patient. A non-restorable caries or untreatable periodontal disease, very badly decayed tooth, or he's got a gum disease, very bad gum disease. You can think of removing the tooth. Internal, external resorption, if the tooth is being eaten away from inside or outside, again, another consideration for tooth removal. Any associated pathology, like any cyst, tumors, remove the molar. Okay, third molar. Fractures involving the tooth, orthodontic, prosthodontic, or surgical need. So these are some indications where you can think of removing the third molar. For this patient, what is the reason? The main reason is his recurrent pericoronitis episode. The third molar should be removed due to the recurrent pericoronitis, which increases the risk of more severe further episodes. So already he's got 2 episodes. The second one more severe than the first one. In case he develops a recurrence again, could be even more, little bit more complicated. Again, these are some factors contributing to the difficulty of extraction. Certain extractions are easy, certain are a little bit more difficult. Now, how do we assess the difficulty of an impacted third molar? We have something called as the Winter's lines, the Winter's war lines. Okay, so war, WAR. Each letter stands for a color. The W stands for white line, A stands for the amber line, and the red line, and R stands for the red line. Okay, so these are three imaginary lines which are drawn on an X-ray. Okay, so that you can identify the difficulty of a tooth removal, an impacted tooth. Okay, so this is a picture. So this is imagine this is a radiograph. You draw three lines, okay, and with three colors. So the white line is basically over the occlusal surface of the molars. As you can see, this is basically the white line. It will give you an indication of the position of the tooth. Now the second line, that is basically the amber line, it goes across the intercrestal bone. Can you see this? It is over the interdental bone. Okay. So this amber line will give you an indication as to when you open up the flap, how much of tooth crown is visible and how much of bone should be removed from the surface of the crown. This is what the amber line will indicate. And then you have a third line, which is basically a red line. Okay, this is the red line. It is also an imaginary line. Excuse me, guys. So this is an imaginary line which is drawn from the amber line to the point of application of the elevator. So if you're planning to place the elevator here, it's an imaginary line you draw from the amber line to the point. So it's a perpendicular line, okay, from the amber line to the point of application of the elevator. This is called the red line. And the red line indicates how difficult. The longer the red line, the more difficult it is. So that's basically about Winter's war lines. So there are some limitations for Winter's lines. It is not reliable for distoangular impactions. It requires adjustments for magnification in panoramic radiograph. It is less informative than a CBCT. Now this patient, it is slight distoangular impact inclination, and the external oblique ridge presence makes the extraction moderately difficult, requiring an experienced surgeon. Again, there are some complications that we have to anticipate with the removal of an impacted third molar. Scenarios can come where they will give you a history and you are likely to, you need to maybe, select what could be the most likely complication that can happen with this patient. So here are some complications that could be happening with the mandibular third molar, complications associated with the removal of the mandibular impacted third molars. One is basically there can be a post-surgical pain. So pain can happen. You have to give appropriate pain medications to help him with the pain. There can be some bleeding, hemorrhage happening. There can be some difficulty opening the mouth. There can be swelling. There can be ecchymosis. And it's also important when you're doing any treatment for ADC, not only for ADC, for in any country for that matter, you need to explain about all of this before you start the treatment to the patient. Explain about the treatment before you take, you have to take a consent before you start any treatment. You have to explain to the patient what is the procedure, what are the pros, what are the cons, what are the other alternative treatments we can give the patient, what are the complications associated with it, what are the expenses associated with it. In case we are not able to complete the treatment, what would we do in that scenario? You have to explain A to Z regarding any treatment before you start the treatment. Okay, so all these has to be explained to the patient even before we start doing the treatment. And once after that, if he's okay, then only we go ahead with the treatment. So the complications here would involve a post-surgical pain. We give appropriate medications. There can be bleeding, there can be trismus, swelling, ecchymosis, and you also give instructions. In case this happens, we have ways to manage it. Okay. So these affect all patients to some degree, and in proportion of cases may be prolonged. Inability to eat and enjoy food is considered a significant complication by the patient. So for some time, it might be difficult for them to enjoy their favorite food. Another complication that can be associated not only with this tooth, for any tooth for that matter, if the patient, so another complication that can be happening is alveolar osteitis. It is another name for dry socket. So we already said, so if the clot is dislodged, what can happen? It can result in an area of exposed, it can result in an exposed area. There's no clot inside. And that condition is called as alveolar osteitis, which is a very, very painful condition. So it's also important that you give instructions as well, post-op instruction. Tell them to avoid activities that can create a negative pressure inside the mouth. Like if the patient, for example, is smoking, you tell them please stop smoking, because smoking, what can happen? Smoking can create a negative pressure. Clot can dislodge. Any activities that can create a negative pressure, like using a straw. Tell them not to do all those. Okay, so alveolar osteitis is another complication. Affects around 1 to 35% low molar extraction depending on the difficulty and technique. An average for surgical extraction is 5% alveolar osteitis. There are other complications as well, like sensory nerve damage, neuropathy, which may be present with dysesthesia, paresthesia, anesthesia, or a combination of all of this. So we know that the lower third molar, this particular tooth for that matter, you can see that it is kind of close to the nerve. So there is a chance that these kind of complications, nerve complications can happen if you're not very careful with the tooth removal. So this affects approximately 10 to 20% of cases, though almost all recover spontaneously. Usually it would be temporary. A degree of permanent damage of the inferior dental and lingual nerves affect 0.5% of the cases, and temporary lingual nerve affects around 2% of the cases. Sometimes even TMJ pain can happen, okay, or dysfunction, arthralgia can happen, around 4% of cases. This is usually higher in patients with a pre-existing symptom and those who test the removal under GA. A mild degree of muscle and joint discomfort is more common. There can be iatrogenic fractures. So if you're not very careful, and if you put too much of forces and remove the tooth, it can even result in iatrogenic fractures as well. What are the percentages? So the fracture of the mandible is fortunately rare. It is very rare. Occur 1 in 1,000 cases. If minor fractures of the alveolar or the lingual plates of the tuberosity are included, the incidence is around 2 to 4% of cases. But apart from the tuberosity fracture, these are mostly of little consequences. Sometimes you may end up not removing the entire tooth, incomplete extraction, less than 1%. Sometimes the patient can even have a post-operative infection. If left untreated, it can even affect the bones. Osteomyelitis can happen. Very rare though, around 2 to 3% in 100,000 cases. And even post-op infection and all, usually the body would be able to take care of the infection unless and until he's immune compromised. Injury to the adjacent structure, including the teeth and periodontium, again, you have to be careful, especially with the adjacent tooth, second molar and everything. You should not iatrogenically create any damages to that teeth. Again, there is, a percentage, 3 in 1,000 cases. Oroantral fistula, another important topic is basically oroantral fistula. So what happens is that if you're removing an upper tooth, or upper third molar, and if it is in close proximity to the antrum is basically a sinus, your air sinus, maxillary air sinus. When you're pulling the tooth out, what happens is that there can be a communication happening between the maxillary sinus and your oral cavity. So antrum is your sinus, or oro is your mouth. So oroantral communication is basically a communication between your oral cavity and your sinus. If that communication is left untreated, what can happen is it can get a skin over it, can get epithelialized and form a fistula. Very rare, but if it happens, it is a very bad complication. Dislodgement of the tooth or fragment into another space. So again, this can happen. Antrum, tissue space inhaled into the lung or swallowed. Antrum basically again sinus. So if you're operating on an upper third molar, and it's broken and there's a small piece of root still left behind, if you're not careful, there is accidental chance that you might push it into the antrum. Very rare though, but these things can happen. Other complications involve systemic medical, surgical complications related to the surgery or anesthesia, death under outpatient GA. So these are all rare complications, okay? What about the antibiotic use? Usually, we don't recommend giving antibiotics, okay, especially therapeutic antibiotics. We don't recommend until and unless there is some indication. For routine procedures, we don't, as long as the patient is not immune compromised. We don't give it in a localized infection, as long as active dental treatment can be done within 24 hours. In case an active dental treatment is not possible within 24 hours, for a local infection, we think of giving, we give therapeutic antibiotic. If it's a facial swelling, again, therapeutic antibiotics can be given. But not usually given, okay? Antibiotic use. Routine antibiotics are not necessary. Even, in important books regarding ADC, it is said that, antibiotics is not a cure. It's just buying us more time. Always active dental treatment is the cure to the problem. So antibiotic use. Routine antibiotics are not necessary. unless there's a high risk of infection, okay? If he's immune compromised. Chlorhexidine rinses and good surgical debridement are effective alternative for reducing post-op infection. What about anesthesia? Usually this can be done under local anesthesia. You can think of sedation as well if the patient is anxious. Like I said before, you can complement it with oral sedation, benzodiazepines, or laughing gas. This can make the patient even more relaxed. So those are some ways of, decreasing the pain, alleviating the pain, and making the patient more relaxed. General anesthesia is also a consideration. If you feel that, the treatment is going to be a long procedure, which can put a lot of discomfort to the patient, or the patient himself is quite uncooperative, okay? He's maybe got severe gag reflex, or he's just not at all cooperative. In that case, you can even, think of, getting the tooth removed under general anesthesia. So GA may be preferred usually as a last option if nothing else seems to be helping this guy. So, but GA can may be preferred for complex cases, especially if the patient has a strong gag reflex or if the procedure exceeds 20 minutes per side. This is in order to make the patient feel more comfortable. So you can either surgically remove this impacted tooth. That's one way. Another alternative you have is something called as coronectomy, where basically what you do is you remove the crown portion of the tooth and then you leave the roots intact inside. So that's another procedure you can do. With the coronectomy also, like any procedures, you have some risks, you have some risks associated. So here also with coronectomy, there can be some risks that can happen. The root can accidentally get mobilized during surgery and you might need to finally remove those roots as well. Sometimes, in the process of, doing this procedure, you may damage the inferior alveolar nerve, damage to the adjacent tooth, again, delayed healing or non-healing socket. Sometimes the roots might migrate, eruption of the roots might erupt. If it is symptomatic, if it's coming out, if it's visible in the oral cavity, later on, okay, once you leave the root, there is a chance that it can erupt later into the oral cavity. In that case, you can even, if it's symptomatic, you can even think of removing those roots later. Okay, so that was about the case, guys. Inside out of the case. Now let's look at a scenario. Let's look at a scenario. How can this be presented as a scenario? So again, a 24-year-old gentleman is referred to you in your oral surgery-oriented practice for a second opinion on the need of his removal of his lower third molar. Is this correct opinion? Is this correct decision? And if it is, how should it be achieved? Patient has previous 2 episodes of pericoronitis. The first was relatively mild, but the second, around 3 months ago, was associated with inability to open the mouth and slight facial swelling and required a course of antibiotics. What radiographs would be the best to assess the impacted tooth? Now I can give it to you guys. If anybody wants to answer, please feel free. What is the best radiograph? What radiograph would be the best to assess the impacted tooth? Is it a CBCT? Is it a periapical? Is it an OPG, an occlusal view, or a bite wing? I don't know if you guys are typing it down or because I can't see the chats. If anybody wants, they can just open up their mics and speak. Nobody wants to speak up? Okay, I can see some answers in the chat. Let me just have a look at that. Yes, okay. So I think most of you have got the right answer. The correct answer is basically CBCT. That's good. Look at the question. If the question is talking about what is the best radiograph to assess the impacted tooth. Definitely, no doubt, CBCT would be the best. Periapicals, OPGs would be initial radiographs that you can think of. And even if in case the patient got a gag reflex or something or trismus, OPG would be better as an initial radiograph. And it also gives you a better picture of the rest of the surrounding structures as well, better than a periapical. But the best radiograph would be occlusal view, bite wings. Yes, these are all different radiographs, but the best one, without any doubt, is a CBCT. It gives you a 3-dimensional picture of the impacted tooth. How close is the tooth to the nerve? Okay. How much of bone is covering it? You get a very good picture. Upper tooth also, you can see how close it is to the sinus, other structures, all that. Okay. Moving to the next one. Give me a second. Okay, so yes, CBCT is the right answer. The second question. On the basis of Winter's lines, which one tells you about the bone removal required around the crown? Okay, bone removal around the crown. Is it the blue? Is it a green line? Is it an amber line, a white or a red? Go for it, guys.
Line, ma'am.
Oh, sorry, I didn't catch you there.
Red line, option E.
Okay, anybody else? Let me just check the chats as well. Okay, Dr. Tanya, I'll help you with this. So there's Sophie saying red, Rajesh red, Arshia red line, Arvind is saying red, and Safwan is saying E, red. So I think maximum of them have answered red line. Okay. Give me a second. Well, the answer, guys, is basically amber, because the question is asking about the amount of bone removal required around the crown. If it was depth of bone removal, you could have answered red. Okay. So the right answer is amber. The red line will indicate the depth of how much of bone would be removed. But how much of bone should be removed over the crown, the amber line gives you a better idea. Okay. No, I don't know how much of, this would be easy. I don't know. What is the risk for temporary and permanent damage of the lingual nerve and the inferior alveolar nerve after extraction? This is based on articles and, studies.
Okay, ma'am. We're getting answers from Drishti, Arvind. Most of them are saying 2 to 1. And D option. Janita, very, very good. Janita is saying A. Anusha is saying B.
Okay, now for this question, I don't blame anybody because even
Okay.
I'm not good at numbers. Okay, so basically this is based on studies. You can refer standard books as well. So answer is basically option D. Okay, 2% and 0.5%. These things, you just have to buy hard these things. Most difficult impaction in the upper and the lower arch are. This is based on the angulation, okay?
Okay, so Anusha says C. Let's see whether it's the right answer or not. Guys, come on, give up the answers. Drishti, Safwan, Arvind, Devanshi, A, D, Nidhi, Shahil, C. Okay, Sophie, Vignesh, Jyoti, C. Vignesh has properly solved this earlier. Nisha, Sandhya. All right, so I think maximum answers are C. Very good, Sahil, Tanmay,
Good.
Abhigna. Yeah,
Yes,
Shazad.
correct answer is C. Yes, for the upper, based on the angulation, mesioangular is most difficult, and for the lower, distoangular is considered as the most difficult. Okay, this is just based on angulation, okay? Now, how will you classify the given case? Okay, maybe I'll just give a brief about this classification before we can answer this question. Okay. So, based on the angulation of the tooth, we can classify impactions into, we can basically classify impaction. So there is mesioangular. If the tooth is inclined mesially, we call it as mesioangular. Okay, so if you were to draw a line along the long axis of the second molar and the long axis of the, and the long axis of the third molar, if the long axis of the third molar is towards the long axis of the second molar, it is mesially inclined. Okay, then you have distoangular impacted. Okay, if the long axis of the third molar is away from the long axis of the second molar. Okay, distoangular. Then you have horizontal. Basically, horizontal would be perpendicular. So the long axis of the second molar, I don't know how much of this is clear. Maybe I can use annotations. Give me a second.
And the answers are coming up, Dr. Tanya. Okay,
You're
Tanmay
ready.
says A, C, Arvind says B, Nidhi B, Sainan, Safwan, Sami, Shahil, Abhigna, Drishti, Sahil, Sandhya, Jyoti, Kashish. Some are saying C, some are saying E. You may go ahead with the annotation.
Okay.
Gaurav, well done.
I'm not able to use the annotations for some reason.
That's okay. So basically, you're talking about the
Okay.
winter lines, right? You can go ahead with that.
Yeah, got it. Give me 1 second. Let me see if I can use this. Yep. So based on the angulation, so if you were to draw the long axis like this, please excuse my drawing, guys, and the long axis of the third molar like this. This is basically the long axis towards the long axis second molar, mesially impacted. If it was away like that, this would be a disto-angular impaction. Okay. Now then you have horizontal impaction. Then you have horizontal impactions, okay, like that. Okay. So the long axis of the first molar, second molar would be perpendicular to the long axis of the third molar, 90 degree. This is basically for a horizontal one. And you have vertical, okay, vertically impacted tooth. Where the long axis of the first molar and the long axis of the third molar are parallel to each other. In line to each other. Then you go to something called as transverse, okay. So transverse is very difficult to, appreciate on an X-ray, like an OPG or a IUPA. CBCT would give a better idea. So this would be, in a buccolingual direction. You would be able to see it like this, okay. So it will be in a buccolingual direction. That's called as a transverse impaction. So that is one that is based on the angulation, okay. Then you have something called as a Pellin-Gregory classification, okay. So you have class 1, you have class 2, and you have class 3. That's based on the position of the crown of the third molar with the anterior border of the ramus. Okay, with the anterior border of the ramus. Okay, so if the crown was completely, anterior, not the crown of the third molar is not at all covered, or it's anterior to the ramus of the mandible, like this. I don't know how much of this is clear. It's like this. Okay, this is a little bit more inside the bone. Okay, this is impacted. So anyways, if it is anterior to the ramus of the mandible, this is basically class 1. Okay. If it is half outside the ramus of the mandible and half inside the ramus of the mandible like this is basically class 2. If it's completely embedded in the ramus of the mandible, entire crown is embedded into the ramus of the mandible, that's basically class 3. Okay. Then again, you have Pellin-Gregory classification based on the position of the third molar with the occlusal plane. So if you were to draw an occlusal plane like this, okay, like this. Oh God, sorry about that. Like this. Now, if the impacted third molar is in line with the occlusal plane, okay, like here, if it is here, you classify it as class A. If it's below, it is basically class B. If it is below the cervical line of the second molar, you classify it as class C. Okay. So if it was here, if the tooth was at this point, if the impacted molar was at this point, along, and in the level of the occlusal plane of the second molar, that's basically class A. If it is below, like in this case, it is class B. And if it is below the cervical line of the second molar, like this, below the cervical line of second molar, that's basically class C. Okay. Now again, coming back to the question. Dr. Sonal, what did most of them answer?
Ma'am, most of the answers were right. And some students are getting anxious about the exam process. All right. So quickly, guys, I think is the last question left, or are we done with the questions?
Yeah,
this was the last. Are we done?
Yeah. So answer C.
All right. So you may change the slide, guys. And ma'am, if you could just tell about the process, Right after two to three slides, we'll move on that, and we can move to the other slides. I'll just tell a bit about
Yeah, yeah, sure.
the other things. You may change the slide, and then after that, we'll take up your questions, Dr. Anita, Dr. Drishti, Dr. Kashish. Don't worry, ma'am is right here to tell you about the entire ADC process in detail. We'll definitely talk about it, and thanks for your patience. And I think this classification was something which is very important from the OS point of view. So, ADC is basically regarding this. So this was the only motto of ours of yours to show how ADC proceeds. And as I was talking about the study abroad program of ours, EduCafic is your pathway to global healthcare education. This is by team Academically. You can scan our code. You can join our WhatsApp channel. Yes, Dr. Drishti will take up your queries as well. And you can get connected to EduCafic study abroad of our channel. If you want to go migrate to study in anywhere, any country across the globe, you can join EduCafic right away. And this is our Instagram channel. You can go through that also and see all the updates, whatever are coming over here, and we'll definitely help you and guide you. The next slide, please. Thank you, Dr. Nidhi. And guys, please scan the code. There's also a link given in the chat box. You can click on that link and you can join our WhatsApp channel to get all the important updates, FAQs, syllabus changes, and top resources in one place. This is our WhatsApp channel. Please scan to join. Next slide, please. And yes, guys, there's so if you're from North, you can come and visit our office in Dehradun. If you're from Australia, you can visit there in Australia. All the contacts and addresses will be given. And our new experience center is available for all the people from southern part of India to come and join. It's in the near Hotel Kinara Grand, Amirpet Road, pillar number A1083 in Hyderabad. Go visit our office, visit our experience center, and all the details about whether you're a dentist, doctor, physiotherapist, nurse, optometrist, all the healthcare professionals are there on one roof. You can go and you can take guidance to migrate abroad over there. Next slide, please. And yeah, so Dr. Akram is right now there in India. And before he leaves for Australia, he will go and meet all the healthcare professional. So on 27th July, we have an event on Dehradun. It's a meet and greet with Dr. Akram. So please, please, please come physically, meet him, meet us. We are all there to, help you to ace your career abroad. Then in Hyderabad, there's a meet and greet session. Physically, you can go and meet Dr. Akram on 2nd August. In Bangalore, it's on 3rd August. And we're also hosting in Chennai. Right, so all the people from these cities, if you want to
Chennai, hi Sonal.
Yeah, hi sir.
Tanya.
Hi.
So, we also have in Chennai on 7th of August.
Right, thank you, sir. So guys on Chennai, yes sir.
And I think yes, on 5th also I will be at KLE College of Pharmacy, Bangalore, and Alamin College of Pharmacy, Bangalore.
All right, great. Thank you so much, sir. Sir, this is a great opportunity for all the students to come and visit you. So guys, this Dr. Akram is right here. You can talk to him also. It is Dr. Tanya as well. So Dr. Tanya can change the slide and then we may proceed with the questions. So please do come visit in Dehradun, Hyderabad, Bangalore, and Chennai. We'll be happy to help you over there. Right? So this was the entire ADC masterclass, and now we'll be taking up each questions one by one, everybody. So first question was for Dr. Drishti. Dr. Tanya, I would like you to answer. Can you, ma'am, explain the entire process of ADC quickly, just once?
Yeah, sure. So to start with ADC, you have to get your paperwork done first. You have something called as initial assessment, where you have to get all your documents and it has to be approved by the board there. Okay, Australian Dental Council has to, ADC. They have to approve it. And once it is approved, you can start with your examination. Only once it is approved, you can start with, there are 2 exams, basically. You have a written exam and then you have a practical exam. The written, so you are eligible for the written once the initial assessment is done. And once you clear your part 1, the written, you would be eligible for your practical exam. Can't hear you, Dr. Sonal. I think you're on mute.
Yeah. So thank you for the entire things. Now there's one question. Okay, Drishti, no worries. Sandhya is asking, can you tell us about the beginners? If somebody is a beginner, how do they prepare for the ADC exam?
Yes. So I would recommend that if you can join a coaching, that would be the first thing that you should do, because you see, it's very wide, very wide. You don't know from where to start. Dentistry, they can ask anything. So first, get yourself, started with an academy, and then you would be provided with, there are certain standard books. Like you can start referring therapeutic guidelines, which is considered as the Bible of Bible of ADC. You have also got certain books which ADC itself recommends. There's also called something called as ODALE, infection control guidelines. And there are certain books which ADC itself has recommended for certain topics.
Right. So if you join academically, we'll all be guiding you through and through the entire process. Ma'am, Aparna is asking, can you please brief about the clinical exam? What kind of questions are asked over there?
Yeah. So by the clinical exam, are you talking about the clinical aspect in the written exam or the practical clinical exam?
Ma'am, both, if you could just say.
Yeah, sure. So the written exam would basically involve questions which are all clinically. Oh, she wants to know about the practical exam. Fine. All right. So the practical exam, once you clear your written exam, you would be eligible for your practical exam. So the practical exam is a 2-day exam. One day you would be having technicals where you would be, you would need to perform on a mannequin. Okay. You would be given around 6 hours and you have around 6 tasks to complete. So you have a crown cutting. You would be given, and then you would have to make a cap, like a provisional restoration on top. You would be given a cavity preparation, an axis opening, and then an amalgam filling and a composite restoration. So you would be given around 6 tasks on various tooth. Okay, that would be the technical day. 6 hours, 6 tasks. Then you have an OSCE day. The OSCE day would be involving your communication OSCEs and your skilled OSCE. So it's 10 stations basically. Okay, I'm so sorry, I got distracted with the chat. So anyways, on the skill communication OSCE day, so you have communication OSCEs, which is basically 6 stations, and you have a skilled OSCE, which is basically 4 stations. So complete 10 stations on the other day. Okay, communication would basically involve a particular case would be given, and examiner will come as the patient, and you are the doctor. You have to basically converse for 10 minutes. It would be based on information gathering, diagnosis and treatment planning, where you have to speak with the examiner, where the examiner is the patient and you're the dentist. Then you have a skilled OSCE, around 4 skilled OSCEs, where you would be assessed for different tasks like local anesthesia task, rubber dam tasks, pit and fissure sealant tasks. There are around, few tasks which you would be assessed on. That's basically the skilled OSCE. So yeah, this is a little bit about the practical exam.
Right. And ma'am, there's one more question. Like Kashish is asking, what's the cost for ADC process? So Kashish, for skill assessment, you have 647 AUD. For written exam, it's 2122 AUD. And for the practical exam, it's 4022 AUD. So that is the official cost. Anusha, for initial assessment, do we have to do only registration or registration and skill assessment? It is registration and skill assessment. Drishti, you registered with Academically. Yes, I know. You're there. You're one of us student. Regarding exam, will this be online or face-to-face? Preeta, so for written exam, you can give it in India. All right. And clinicals, you have to travel to Melbourne and give. Devansh, you can convert. Okay, AUD in INR, it's about. It's the same, Sandhya. For Pakistan also, AUD can be converted. Yes. Sahil, fees for the course. So our counselors will be connecting with you and they'll be giving you a one-on-one video session. You can go and you can do there. Sahil, job market is fabulous, and that's why the dentists are migrating to Australia, because you get a very, very good salary over there, right? Dr. Anita, you can unmute yourself and you can ask your question, please. Dr. Anita, you've raised your hand. You can unmute yourself and ask a question. Okay, we can move to Dr. Ravi Dikshit as well. The coaching is online, Dr. Sophie. We are preparing on that, Dr. Drishti. Dr. Ravi, Dr. Anu, you can speak up, guys, if you have any question. Salary for the dentist, well, definitely more than India, Dr. Apurva. It ranges up to like you have very easily you earn more than lakhs over there per month. Aparna, the counselors will connect with you on one-on-one basis and you can talk. Okay, so the coaching fees, if you talk about practical exam coaching, yes, it is available in India. Yes, but we are also trying on that. Yes, so Dr. Akram has shared the link, guys. You can check on that. Okay. Thank you, Sami. Tell me, do you have the permanent license for the initial assessment, or we can register for temporary license like one week? No, 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 nothing of that sort. There's no houseship in India as well, Dr. Sami. It's internship. Okay. So you have a permanent license over there and you have to get it renewed. Right, Dr. Tanya from APRA? This is the way it
Yeah,
works?
yeah, yeah. Yes, yes. Once you're registered, you have to keep renewing your registration. Yes.
Okay. All right. Next question, guys. Should we start preparing for ADC from BDS second year? Is Ayushman's question, Dr. Tanya. What do you say?
No, I don't recommend that you start preparation from second. Maybe concentrate on your BDS now. You read all the topics, get yourself, very, get a proper understanding of each concept. Okay, once you reach your internship, either during the internship or once you finish internship, you better concentrate on your ADC, because ADC requires full concentration. You will not, it's a complex exam. So, basically, study BDS right now.
Okay, Janita is asking, are they accepting a 4-year degree? Yes, 4-year plus 1-year internship should be there, Dr. Janita. How much general preparation time is required for the exam, as it's been over 5 years gap after BDS, Dr. Ravi is asking. Dr. Tanya.
Sorry, I didn't listen to that question.
Okay, so he has a 5 years gap after BDS. How much general preparation time is it required for ADC?
So there's no preparation. It all depends on person to person. Okay, if you are a fast learner, you could prepare faster and you can give the exam before. But if you take time, and also we all have our own responsibility, right? We have family, we've got job and everything. So in that case, you might take a little longer compared to a person who's just graduated, not married, no responsibilities. Might take you longer. There's no particular fixed time, but the faster you start, the better.
Next is minimum how much time it may take. Dr. Apurva is asking. As ma'am has answered, you're welcome, Dr. Ayushman. Safwan, the counselors will connect with you and you can talk. After MDS, okay, ma'am, what's the difference? Like if somebody has done BDS and somebody has done MDS, what's the difference in the ADC preparation for them?
Well, if like certain tasks would be easy for somebody who's done MDS. Like for example, a crown prep task would be easy for a prosthodontist compared to a BDS graduate. But that doesn't put a BDS graduate anywhere down. It all depends, end of the day, how skilled you are individually. And ADC, they're looking for general dent. They're looking for fresh graduates. Okay, and it doesn't make a difference if you're a BDS or an MDS. As long as you have reached the rubric that they want, you would clear. Yeah.
Right, correct. Next is Anusha's. How many months it's told? Hi, Dr. Vignesh. Yes, so Dr. Tanya will be joining you in the class, no? Next week, right from Monday, you can ask her. Okay, you can ask me. Okay, tips for preparation. Now she keeps on sharing. Dr. Vignesh is always there in the class. No worries. Books to be referred. Dr. Anu, you come join academically. We are there to guide you through and through. Course fees, Dr. Nisha, as I told you, the counselors will be connecting with you and you'll get a proper one-on-one video conferencing session. If you are near Hyderabad, Chennai, Bangalore or Dehradun, you can come and visit our office. You can come and visit Dr. Akram in person and you can, discuss with him as well. So it's an open invite to all of you all, guys. One person, one mentor can change your entire journey. So that is why, before sir leaves for Australia, do come and visit him. How can I do ADC? I'm from Bangladesh. The same method, Dr. Mezibin, for you also. Can you give ADC exam after FCPS? Yeah, definitely. If you have a degree for 4 years, FCPS doesn't matter a lot. You have to be a registered dentist in your country. That's the only thing. I actually expected for a detailed presentation about exam process and further details. No worries, Dr. Abhigna. You can switch on your mic and you can talk one-on-one. Dr. Akram is there. Dr. Tanya is there. I'm there. Switch on your mic. And you can talk instead of presentation. That's fine. Can you pursue a master's in Australia after ADC? Dr. Gaurav is asking. Can you, Dr. Tanya?
You can. I think once you're registered, I'm not very sure about this, but then once you're registered, I think you have to maybe work for a couple of years or something. Not very sure. But yes, you can definitely get your master's done. Not an issue. But if you want to work clinically, you have to clear your ADC exam. Otherwise, you cannot touch the patient.
Yeah. Dr. Preeta is asking ORE or ADC exam, which is difficult. Dr. Preeta, it's not about the difficulty. ORE, you have to travel to London and then sit for the exam. ADC is you can sit in your home country and give the exam. So which is very, very, beneficial economically also and also for your comfort. How Australian dentistry is compared to UK. Dr. Ravi, now that dentistry is same everywhere. It's the guideline in the methodology and the type of country you want to go. Australia is good for PR, as sir says. Sir is there with us. Can we just ask him, because he's been in Australia and he knows how things work. Sir, do we have you over here? Yes, sir.
Yes, Sonal.
Sir, Australia में like what is the best thing? हम UK क्यों नहीं जाए? Why do we
Yes,
should
I
go
think
Australia?
Tanya also can give. She is also there. I will add on.
Yes, sir.
First of all, if you want to get PR, it's very, very fast in Australia. As compared to UK, it will take at least minimum 4-5 years in UK. If everything, online, like in line, you pass on time exam and you need to find a job, sponsorship is there and work for 3 years, then you are eligible to apply PR. But in Australia, straight away you can apply once you pass part 2 exam. And weather is very, very nice. It is similar to India. Like we have, and a lot of Indians migrating to Australia. So right now, if we just talk about the top 3 countries, the Indians are one of them. So every year, 50,000 Indians migrating to Australia on permanent visa. And the children's education is free up to 12th, and after that, they give the loan to the students. And apart from this, healthcare is free. There is no need to buy any insurance in Australia. It's going to be universal health coverage. They will give you the Medicare card, so all of your family. And yeah, these are the few things I want to say. Yeah.
Thank
And
you so much.
salary is very, very high.
Hmm.
So
The
one of
best.
my friend, he's a pharmacy lecturer in UK. He's getting 37,000 pound per year, means around 37 lakh per year. But if he's in Australia, he will get at least minimum 70 lakh. So salary is double, in Australia as compared to UK. So if you see the white guys, they are, जितने गोरे लोग जो ऑस्ट्रेलिया में हैं, वो यूके से उल्टा माइग्रेशन करते हैं ऑस्ट्रेलिया के लिए, So many people, they went to Australia, UK first. Now they're migrating to Australia, even from maybe in like Ireland, even many of them coming from Canada also. So weather is also very, very important. Like in Canada, there's some place 4-5 months तक वहाँ हमेशा बर्फ रहती है. There is no, you can't see the sun. But in Australia, it's not like that. So there's a lot of advantages to move Australia over to UK. Yes, Dr. Tane, if you want to say something.
No, sir, you beautifully, handled that question.
Actually, मेरा वीडियो ऑन नहीं हो रहा है. फैज ने पता नहीं क्या किया हुआ है.
It's okay, sir. कोई बात नहीं. There was some issue. Actually, there was some technical issue, sir. And Dr. Tanya, why did you choose for Australia? Like, it's a simple question.
Well, after my graduation, I was also thinking what to do next. Should I, go for MDS, or what next? What next? So then I had my relatives in Australia. Okay, so that's the basic reason I chose Australia. I have my sister-in-law and the entire family there. So they told me, why don't you just give this exam? And then I gave, and I was lucky I cleared in the first attempt. So yeah, that is the reason why I chose us. And also I did some research as well. Okay, like not that I just blindly went forward with ADC. One, like you said, Dr. Sonal, the written can be written in India. So that was one advantage compared to UK. And definitely Australia gives, the best maximum benefits to dentists as well. So, you get, it's one of the best countries where, dentists can migrate as well. So yeah, these are some reasons which I chose ADC.
Okay. Yes, Dr. Mezabin, you want to speak? You want to ask some question?
Yeah, hi. I
Hi.
want to know that after clearing the ADC, what kind of job I can have from hospital based job, or I have to open a clinic like in our country we open a clinic by registration. I have that question.
I think you can, you can do all, you can do both. You can open up your clinic, but you would need a registration. I think Dr. Akram would be better handled to answer that question. But yeah,
yes. What was the question?
So the question was that after finishing a BDS, can we open a clinic there in Australia, or we can
Yes,
work?
100% you can. I mean, you need to pass both exams, and get, some experience in Australia while you are working there. And opening clinic is not easy task in Australia. It needed a lot of money. So my advice to please pass the exam and become a registered dentist there. at least 3 to 5 years work there, make money, then you can think about to open your own clinic. You can basically.
Yes.
I can work there in any hospital or clinic, right?
Yes, yes. Once you pass, you are eligible to work in
Oh,
any private clinic, even or government.
okay. Thank you.
Thank you, sir. Next, Dr. Shahil, you want to ask some question? You can unmute yourself. You have
Uh,
raised your hand. Yes.
okay, I am practicing for 12 years in India,
Mhm.
and before starting for ADC preparation with academically, is there any books or any other brochures or any other task which can I can complete before that?
You don't need to. You just need a normal degree of 4 years. Actually, you don't even need an experience. But since you have a 10 years of experience, clearing the ADC exam is much more higher. Like the probability is higher for you, Dr. Shahil.
But before preparing for the ADC exam with academically, I just
Mhm.
want to ask that is there any books or any other material which I can go through?
Yes, Sahil, I mean, you can go to academically.com and there is one blog. And उस blog में important books जो सी हैं हमने mention किए हुआ, so you can read and you can start preparation accordingly
Okay,
from your home. Yeah.
that's why I'm asking.
Maybe I will pin the link in the group. I will find the. I'm trying to find.
Okay, sir.
Thank you.
Thank you.
Thank you so much, sir. And next question is, okay, we have answered. Deepika, is eligibility enough for each exam? Yeah, you don't need to score top. I think Dr. Tanya, getting grade B in every cluster is the minimum
Yeah, so
criteria.
you have 4 grades at A, B, C, D.
Hmm.
Okay, I think it stops at D. Okay, I did my written 2 years back, so not very sure. But anyways, I think A, B, C, D. There are 4 gradings.
Mhm.
You have to get either A or B in
Yeah.
each paper. Okay,
Yes.
that's it. Clear. You don't have to get top A. You don't have to get at least B. If you manage to get, you clear the exam in
Okay, I'll
each paper.
just, yeah, each paper. I'll just elaborate a bit. So basically, guys, if you talk about the ADC written exam, you get scenario questions. Like the way Dr. Tanya was discussing scenario question. Okay, you get one scenario, it will have 5 sub questions in one scenario. And in 2 hours, like, so basically the exam is conducted in 2 days. Okay, like today and tomorrow. So today you'll be having 2 shifts in the morning and in the afternoon or evening. And similarly, tomorrow, like the day 2, you'll be having 2 shifts, okay, in the morning and in the evening. Now, every shift, there'll be 4 shifts. Every shift will be of 2 hours. And in those 2 hours, that means in those 120 minutes, you have to answer 14 cases. Okay, 14 cases, each having 5 sub questions. So 14 into 5, 70 questions in 2 hours. 70 questions in 2 hours, the kind of questions Dr. Tanya had discussed, that is there. And so total will be 70 into 4 shifts, 280 questions is the total thing. And there are 4 shifts, so 4 clusters. There's health promotion, there is diagnosis and treatment planning, then there is patient evaluation, and then there is community thing. So in every cluster, you have to score B. Right, Dr. Tanya? Yes.
Yeah, yes. So A or B.
Yeah.
Okay.
The minimum is B, right? Where can I fetch more details about ADC preparation course by Academically? You can visit our website, Dr. Risman, and now that you've come, the counselors will reach out to you and you'll be given a one-on-one full video interactive.
ये link already हमने दिया हुआ है. You can go to this link.
Yes, sir.
And I'm also adding one more link. This is a ADC book जो आपने पूछा था. इसका भी मैंने link डाल दिया यहाँ पर.
Okay, so doctor, you can check the link. Sir has already put it up. Recommendations for clinicals. How? Achha, they're asking how do you prepare for clinical exam, Dr. Tanya? How did you prepare for the exam?
I mean, currently we are offering part 1, not part 2. Once you pass part 1, then भाई आप आओगे part 2 पे. So academically सारे एग्जाम की प्रिपरेशन करता है. Like हमने पहले AMC लॉन्च किया था part 1. अभी हमने part 2 भी लॉन्च किया. कुछ बच्चे पास करेंगे part 1 तभी तो part 2 लॉन्च करेंगे हम लोग.
Right.
Part 2 पहले part 1 आप पास कीजिए. Then we will definitely we provide academically is the first edtech in the world. We are only focusing on the licensing exams only. Whether it is part 1, part 2 और part 3, जितने भी steps होंगे वो सारा हम ही complete कराएंगे आपके. तो अभी हमने start नहीं किया है ADC2, तो उस पर हम comment कैसे करेंगे. But obviously we will. Right now we are offering for medical doctors AMC2 और NREX Set 2 जो एग्जाम है for न्यूजीलैंड का, तो उसको हम ऑनलाइन ही पूरा उसको प्रिपेयर कराते हैं.
Right.
जो ऑस्की एग्जाम है तो ऑस्की को अकॉर्डिंगली हम लोग प्रिपेयर कराते हैं. And I am basically one of the expert for OSCE. I basically take the classes for pharmacy at University of Sydney here in Malaysia. तो I know कैसे prepare कराना है basically OSCE exam, clinical exam के लिए. तो अभी हमने launch नहीं किया ADC 2, but definitely we will once you pass this ADC 1.
Thank you, sir. So you've got it from Dr. Akram himself. So we'll be launching that. But first is important to pass the ADC1 exam. Okay. Yes, you can work after part 1. You can work under a supervision of a dentist over there. But you need to clear the part 2 exam, Dr. Drishti. Okay.
Yes,
And
Samir Rahman asking one question. Is English proficiency test is required for initial assessment? No. You can give after you pass part 1, even, so no need at this moment.
yes, and we are also preparing for English also. If you want to prepare with Academically, we offer
Yes.
the preparation course.
We offer PT, OET, IELTS, all these preparation also. So academically, it's like आपके जितना भी है steps will help you to complete your documentation process, ADC 1 or English test or ADC 2, whatever you need, we will cover entire things. It's not just this ADC, we providing ADC coaching.
Yes, correct, sir. Subhashmita is asking, please explain what to do in the initial assessment process. It's a documentation process basically, Subhashmita. You have to upload your documents. It will be scrutinized whether you're a registered dentist in your country or not. And then they give you the eligibility to book the exam. So Academically guides you in that also. We have a separate skill assessment team who have done more than 100 skill assessments for the people, for all the healthcare professionals. So you can take guidance from us. Can an MDS postgraduate get into academics in Australia? What is the path? MDS postgraduate get into academics in Australia? So
Yes, I mean, very simple rule. You must be a registered dentist in that particular country wherever you want to work in academics. अगर आपको लाइसेंस ही नहीं है, then how you can teach the student, right? So academics में people को लगता है खाली डिग्री है हमारे पास में and we can directly work, we can skip the exam. So you need to pass ADC and get licensed in Australia. Since you have already master degree, then you can try for in academics. And very important in academic, it is not just teaching. Research is very, very important. If you have a very strong profile, definitely there is a good chance for you to enter into Australian market, especially in academics.
Yes, sir. Correct. And sir, Ravi is asking, do we really need friends or relatives there to live, or people are good to accept us?
मेरा कोई है नहीं आज तक ऑस्ट्रेलिया में, तो आई एम लिविंग लास्ट 8-9 years. तो जरूरी नहीं है कि कि आपका रिलेटिव हो. तान्या का रिलेटिव थे, वो वहां पे गए, बट मेरा कोई भी नहीं था और अभी भी नहीं है कोई रिलेटिव बेसिकली. तो आपको अगर लाइफ में आगे बढ़ना है तो प्लीज डू नॉट डिपेंड एनी ऑफ रिलेटिव और फ्रेंड के ऊपर नहीं रहना है आपको. एंड वैसे भी जितने भी फ्रेंड जितने रिलेटिव होते हैं ना, पहले तो बोलते हैं आप आओ मैं आपकी हेल्प करूंगा, बाद में आपको लेने भी नहीं जाएंगे एयरपोर्ट पर, वो आप अकेले रह जाओगे वापस. ऐसी बहुत सारी स्टोरीज आती रहती है ऑस्ट्रेलिया के अंदर. यस, तो प्लीज आप यू आर सफिशिएंट, यू आर डेंटिस्ट, राइट? तो आपको किसी का नीड नहीं है एंड यू कैन गो एनीवेयर. ऑस्ट्रेलिया वेरी सेफ कंट्री. आप कहीं रीजनल में भी जाएंगे तो ऐसा कोई प्रॉब्लम नहीं आएगा आपके लिए, एंड आई वांट टू शेयर माय पर्सनल माय ऑन एक्सपीरियंस बेसिकली. तो मेरा कोई भी नहीं है सिडनी में अभी तक ऑस्ट्रेलिया में. जब मेरा एडमिशन हुआ तो आई फाइंड वन ग्रुप इंडियंस इन सिडनी करके ऑन फेसबुक. I posted in that group के I got admission is there, I am coming in this chat, so I need accommodation. There is some people reply me, and one of the guy reply me and मैंने उसको पैसे पे कर दिए और मेरे साथ में रहा 1 साल तक. मैं उसके साथ ही रहा सिडनी के अंदर, तो ये आपको खुद से ही मिल जाएगा. इवन वो मुझे पिक करने भी आ गए थे एयरपोर्ट. मेरा एक फ्रेंड था वहां पर, तो अरे नहीं भी आता तो अभी मैं एक उबर चलती है वहां पर या टैक्सी करते हुए पहुंचा था उस एड्रेस पे जो उसने मुझे एड्रेस दिया था. तो इतना कोई प्रॉब्लम नहीं है. इवन आई वेंट टू मलेशिया, वहां भी मेरा कोई नहीं था. ठीक है, तो रिलेटिव्स के ऊपर ऐसे आप रिलाई ना करें. एंड दिस इज योर जर्नी है, आपको ही पूरा करना है. एंड अगर आप समथिंग बिग करना है लाइफ में तो आपको रिस्क तो लेना पड़ेगा. कोई भी कंट्री में आप कहीं भी जाएंगे, इवन इफ यू आर फ्रॉम नॉर्थ इंडिया, इफ यू गॉट ए जॉब इन तमिलनाडु या केरला, ना तो आपका लैंग्वेज है वहां पर, ना आपका फूड है, हाउ यू विल सर्वाइव देयर. सिमिलरली कोई साउथ इंडियन है, मे बी फ्रॉम तमिलनाडु, इट गॉट ए जॉब इन बिहार और मे बी उत्तर प्रदेश, so this is same thing for you. You need to do the similar thing.
Right, sir. Right, sir. And sir, they're asking, Sophie is asking, will ADC exam provide opportunity for government jobs in Australia?
Yes, I mean, basically, once you are Australian citizen, Australian PR holder, you are eligible to apply all the jobs. So most of the time, government job, they ask if you have PR holder or or if you are on citizen, then only you can apply. Certain jobs only for citizens, certain jobs you even can apply on PR visa. But if you are on a study visa or any other visa, you cannot apply, but you can apply in a private job, So basically आपको start करना है. Even many local लोग जो होते हैं private में, they prefer to work, not in the government, because government में salary कम होती है. Private में you can make a lot of money. So जो locals होते हैं, they are not. This is the Indian basically mindset. We want to work in government only, right? Because in Indian system there's a lot of corruption and you can make the money in that way. But in Australia there is no corruption, zero corruption I can say वहाँ पर. और जो सैलरी है वो इतना ही आप कमाओगे, कुछ भी आपको पैसा एडिशनल नहीं मिलेगा. Like in India, we work in government and we do private practice in the evening, right? We make money and sometimes we refer the patient government hospital में देखा तो भाई शाम को मेरी क्लिनिक पा जाना. वहां पर आप ये नहीं कर पाओगे, ठीक है? तो जुगाड़बाजी तुम्हें चलेगी नहीं. And people prefer to work in private, learn there and make some money. Then you can open your own clinic. But आप अगर आपको गवर्नमेंट में ही करना है तो you can basically, so there is no
Yeah.
problem.
Yes, sir. Next, Sami is asking, is English proficiency test required for initial assessment? No. Okay. After the exam, you can give your English proficiency. We have to give any exam for joining Australia government hospitals if you don't want to do private clinical practice. I think sir has answered this question, Yashika. Is PT recognized all over the country? Yes. How many attempts can we give for both written and practical? So, Dr. Anita, for written exam, you have 7 years. So basically, your skill assessment is valid for 7 years. And in 7 years, every year the exam is conducted twice. So you can give it in 14 attempts. Similarly, practical exam, written exam is valid for 3 years. So for practicals, you have 6 attempts to give. So you have more than 20 attempts actually for the exam. 20 attempts is a big thing. Is there any waiting list for the exam? No, Dr. Nazneen. So does Academically help with ADC part 1? Yes. Can we join our, okay, Drishti, I've answered. Do we have to clear Australia? Okay, cleared. Going to Australia for ADC part 2 come with risk, right? Is it safer to go on student visa or preparing for the exam? Sir, this question Risvin is asking. Going to Australia for ADC part 2 come with risk, right? Is it safer to go on student visa and prepare for the exam
I
there?
mean, yes,